Remember to subscribe, and hit the bell icon, to never miss an update from Dr. Mike Baby Care Channel.
Your pregnancy. Week 24. You might be able to feel your baby moving from the outside now, by putting your hand on your belly. As your baby gets bigger, you and others will be able to see your baby moving. Towards the very end of your pregnancy, you might even be able to recognize some body parts. Other people might comment on your belly or even touch your belly, even if you haven't asked them to. It's okay to tell people not to do this if it makes you uncomfortable. It's your body. Your baby's development at 24 weeks. At 24 weeks, your baby is about the size of a cantaloupe. Baby's auditory system is rapidly advancing, which means if she frequently hears a certain song now, she's likely to recognize it and feel calmed by it when she's born. Your baby is in rapid growth mode, putting on about 3 to 6 ounces each week. Part of that weight gain is coming from the addition of fat. This fat does more than smooth out wrinkles, it also helps the baby retain body heat and regulate temperature. Babies born at 24 weeks can survive outside the uterus, but they are extremely premature. They have difficulty breathing, need advanced medical care, and often have many health challenges. 24 weeks pregnant symptoms. While you might feel inspired, energetic, and overall in a good mood, the growing baby could put extra pressure on your bladder and cause frequent urination. Here are other common symptoms at week 24 of pregnancy. Weight gain. You are gaining weight slowly and steadily, which isn't a cause for concern. You should gain some weight, but if you notice vast amount of weight gain during a short amount of time or even losing weight, you should visit your obstetrician immediately. Vaginal discharge. Vaginal discharge at this stage causes discomfort for many women. It is up to you and your doctor to establish type and amount of discharge you will consider as normal. This depends on your past health history and your individual body characteristics. However, if there is a change in quantity, smell, color and associated pain of your discharges, don't hesitate to seek medical attention. Vaginal hygiene is very important at this stage. One of the most frequent dilemmas regarding the vaginal discharge is the inability to distinguish whether it's the vaginal discharge soaking your underwear or there is a possibility of an amniotic leak. Because it's very common for the vaginal discharge to be increased, women often feel scared that they are losing amniotic fluid. Thankfully, telling the difference between the two is usually pretty easy. When the discharge is amniotic fluid, it feels like a steady trickle or gush, with more of a light yellowish tint than a white one, and a thinner consistency than that of leukorrhea. However, if you have any hesitation, always call your doctor right away to be checked out. Carpal tunnel syndrome. You could be experiencing a tingling sensation in your joints, uncomfortably numb wrists and fingers, which is known as carpal tunnel syndrome. It is a common condition during pregnancy which occurs due to fluid buildup in your joints, which results in compression of the median nerve. Get relief by avoiding sleeping on your hands and propping your arms up with a pillow at night. Shaking your hands and wrists and take frequent hand stretching breaks might also help. Luckily, when the regular swelling of pregnancy stops after delivery, the carpal tunnel symptoms go away too. You might also experience some of the typical second trimester discomforts such as aches and pains, Braxton Hicks contractions, food cravings, forgetfulness, leg cramps, leg swelling, nasal congestion, constipation, and round ligament pain. Pregnancy checklist at 24 weeks pregnant. Kegel exercises get your vaginal muscles and perineal muscles ready to deliver that baby and can reduce the likelihood of tearing. Plan postpartum childcare, how soon after childbirth you will be getting back to work. Get your home baby ready, start baby-proofing your home. Research the possibility of a postpartum doula. Know the signs of preterm labor. At 24 weeks, get ready for the glucose screening. Your doctor will give you the glucose screening between 24 and 28 weeks. If your blood sugar levels show that you have gestational diabetes, a temporary condition that appears during pregnancy, you'll likely have to modify your diet, monitor your blood sugar at home, and possibly increase your activity levels. While researchers aren't certain why some women get gestational diabetes while others don't, they do know that you may be at an increased risk if you are overweight, are older, are pregnant with multiples, have a higher level of abdominal fat, or have a family history of diabetes. The week 24 of your pregnancy is the time of great transformations and changes. The further along into the pregnancy, the harder will it be for you to determine what's normal from what's concerning regarding the symptoms and changes of your body. To avoid worrying, make sure to establish a norm with your doctor regarding kick count and baby activity, vaginal discharge, abdominal and back pains, as well as swelling. This way, you will avoid worrying and enjoy the final months of your pregnancy. Thank you for watching. Don't forget to subscribe.